Hi, my name's Luke and I'm a physiotherapist with a clinical specialist interest in diagnostic ultrasound imaging and ultrasound guided injections. And in this video today, we're going to talk about post-injection information. So after you've had your injection, things to be aware of and things to look out for. Now, the first thing we need to know is that a steroid injection is made up of two components. The first is the corticosteroid, which is a potent anti-inflammatory, and that's used to control the pain, and that's the reason why you go for your injection. And the second thing that is used is a local anaesthetic. And a local anaesthetic is used just to numb the local area to make the procedure more comfortable, and that can last between 1 or 2 hours depending on each individual. Now, if you've had local anaesthetic, you need to be aware that, especially in the lower limb, that you might find it difficult to drive. If you've got a slightly numb foot, then you might not be able to do an emergency brake, and therefore you wouldn't be insured on your car insurance. So if you're having a lower limb injection and you're having local anaesthetic as well, the first thing you need to be aware of is that you might have a short period of numbness, and therefore it's most probably best to ask someone to drive you to and from your appointment or use some public transport just to be on the safe side. Now, the general advice is if you have an injection into your joint, like your shoulder joint, finger joint, knee, etc., then you need a good couple of days of relative rest after your injection. And I typically say around 4 to 5 days of rest after a joint injection. Now, that doesn't mean you go to bed and you do nothing and you lie around and just get everyone to wait on your hand and foot. But we would typically say drop your step count by about 50% for that first 4 to 5 days, and then you can start adding in all your normal activities of daily living again. If you're having an injection into the soft tissues, such as into a little bursa, and a bursa is a fluid-filled washer that sits between tendons and bones, for instance, if you're injecting around those, then you need slightly longer break. Now, we typically say you need a good 10 days to 2 weeks after a soft tissue injection. And that's really for a couple of reasons. The first is when you inject into an area, into the soft tissues, like a washer, like these bursas, then some of the steroid can infiltrate into the surrounding tendons. And tendons are well documented to have a period of compromise after an injection, and that can last around 10 days. So what we don't want you to do is come out of your injection and feel great. You've had a shoulder injection into your bursa, you feel brilliant, and then you go start throwing balls for the dogs or go straight back to the gym and push big weights above your head. You are at a risk in the first 10 days to 2 weeks of causing a rupture of your tendon, and therefore we need to take that super easy. Anaphylaxis is an incredibly rare allergic reaction that can happen after any medication. Now, we know that from the research that the most common medication to have an anaphylactic shock with is with local anaesthetic. So if you know that you've got an allergic reaction to anaesthetic, then make sure you tell your clinician before you have the injection so that he can avoid using it. Now, there's about 1 in 500,000 people have an anaphylactic reaction after an injection, and typically it happens very quickly. It can be within minutes or up to sort of 10 to 20 minutes time after your injection that you start to feel very strange, and you can start sweating, you can develop hives, your heart rate can really race, you can have trouble swallowing and speaking, and in those situations you might even start feeling dizzy or even lose consciousness. And for this reason, clinicians who inject will typically try to keep patients within the waiting room for about 20 minutes after the appointment, just to make sure that you're safe to go home. And once you've passed that, then you're typically safe to crack on with your day and get back to normal. The second serious complication that can happen around injections is an infection. Now, injections are incredibly safe, and there's a 1 in 100,000 chance of developing an infection after an injection. So please don't worry about this. However, there are a few key things to watch out for to help you realise whether you have an infection or not. Now, an infection is a development of a bacterial colony within the joint that's been injected. And typically it takes time for this bacterial colony to develop. And so it takes around 5 to 7 days for you to develop an incredibly painful joint. So if it's your knee joint or your hip joint, then you'll have real trouble weight bearing through it. It will be incredibly painful, it will be swollen, and it will be red in the area of the injection. And you may also have a fever with this. And if you do have these signs or symptoms after feeling great for about 7 days after your injection, then you must go to accident and emergency straight away and let your clinician who injected you know straight away. Many people after injection, and we know it's around 20% of patients have injections, have a short period of pain. And this is called a post-injection pain flare. Now, there's nothing to be worried about this, and it's incredibly common. This can start happening as soon as the local anaesthetic wears off. So you could be fine for a couple of hours after your injection, you get home and then your shoulder really starts to hurt. Now, that's absolutely fine and normal, and it lasts anywhere between a couple of hours to a couple of days. Now, this isn't a medical emergency and you shouldn't worry about this if it happens immediately after your injection. General advice for this is to put some frozen peas on the area, take some painkillers, you can use paracetamol or ibuprofen, rest the joint for a couple of days and that'll settle down rather nicely, and then you can start your rehabilitation program. Now, another thing that can happen after a steroid injection is something called skin depigmentation. Now, this is incredibly rare, especially these days with ultrasound guided injections. We can really target the tissue that we want to affect. Now, what happens with skin depigmentation is some of the steroid infiltrates into the soft tissues above the target site within the skin. And whilst it's sitting in there, it can corrode the skin pigment and change its colour. And what people are left with is a small white patch over the site of the injection. Now, in most people, this just disappears over time, but it can take a long time and it can be distressing whilst it's there. The next post-injection complication to think about is fat atrophy. Now, fat atrophy is very much like skin depigmentation in many ways. It's an incredibly rare thing that happens after injections, and now we have ultrasound guided injections where we can target the tissue very precisely. The chances of this happening are very small. But essentially what happens is steroid gets deposited within the superficial tissue into the fat cells, and whilst it's in those fat cells, it has a corrosive effect on the fat tissue, and therefore the tissue atrophies and you're left with a dimple in the skin. And this can be really, really challenging if you're having an injection, say, into the base of your foot, where you can lose the cushioning in the bottom of the foot. But once again, I must stipulate that this is incredibly rare, especially with ultrasound guided injections. Another post-injection complication can be fluctuations in blood sugars. Now, this really only affects people with diabetes and is still very, very rare in this subpopulation. The steroid can affect your blood sugars, making them spike, and this can make some diabetics feel rather poorly for a couple of days. So if your diabetes is well controlled, then you shouldn't have an issue. However, if you are diabetic and you are uncontrolled blood sugars, and this may be something that you need to consider before attempting a steroid injection. Period after the injection. Now, if you've got glaucoma, then it's really important that before you go for your steroid injection, that you have a chat with your optician and get their consent to allow you to come and have a steroid injection. Now, like all medication, there are many, many other little side effects that may happen which are short-lived. And this can include situations where you have facial flushing for a few days or few hours. You can have changes in your mood that last for a short period of time, or even changes in your menstrual cycle. But these are short-lived and they are incredibly rare, and they're nothing to worry about. I hope you enjoyed listening and watching this video today. If you did, then please feel free to like or subscribe to my channel, where there'll be lots more content about diagnostic ultrasound and injections. Thanks for listening.